If you're one of those people who have been wanting to buy an inversion table, then today my video is going to go over what you should do exactly in order to help with your back pain. It's not buy an inversion table unless you're a small percentage of the people, but we will go over that today on the Wellness Doc. Quick intro. This one is called the Teeter. It's probably the most trusted brand, the Nike of inversion tables. And let me tell you that most people, you don't need an inversion table. There's a big time risk with inversion tables, and we'll just go condition by condition, a few of people who can use it and people who can't use it. The best place to start if you have back pain is start with some stretches, contact a chiropractor, contact a physical therapist. The reason I have such a strong opinion on these inversion tables, I used to know the guy who sold inversion tables across the Midwest, and I know he had to stop selling the inversion tables because there's a big risk factor to them. There's a huge liability. Well, now you have companies like Teeter that are so big that they can cover their behind, or their lumbar spine, as I like to say, chiropractor joke. So they won't get sued, they're not liable for what goes on once you go upside down. So here's the concept that Teeter and inversion tables have. Once you lay your back on this table and you start to flip upside down, in theory, your spine is supposed to spread out, relax your muscles, get blood flow and nutrients to the disc. Well, that's not exactly what happens. The reason it doesn't happen is because if you go upside down, your muscles immediately try to contract. It'll never get down to the level of the disc. Let me show you how that works. So let's say someone has a herniated or bulging disc, is definitely a condition I don't recommend for an inversion table. So you have a disc that looks like this, and that bulge is out there. Now what they say is once you go inverted, that bulge will come back in and get away from the nerve. Well, there's many components and many forces that play into that. If it was that easy, really at my clinics, I would just hang people upside down, bill their insurance, and be done with it. But it's just not that easy. So here's conditions that should not use an inversion table: bulging or herniated disc, herniated discs, degenerative disc, nope. Sciatica, probably not. Numbness or tingling in the leg, I wouldn't trust it. Here's the people that can use an inversion table safely. More than likely, I can't even guarantee that. But the people who can use the inversion table safely are those that just have your typical everyday back pain, which it shouldn't be typical. So that's my whole point. If you want to do a maintenance, how about that? If you have no back pain, then you can do this for 3 to 5 minutes like Teeter says to do, upside down or at least on a gradual angle, and hopefully you won't get back pain. But you probably still will, because this isn't the one thing that fixes all back pain. It's just not, in my opinion, it's not as good as they make it out to be. They run anywhere from $250 to $600. This one I think was around $350. I'll be returning this. I didn't even like it enough to keep it around to put my patients on it supervised. So that kind of tells you my opinion about this. If you think you are one of the ones that want to try it, this is a product recommendation video. So technically I'm recommending it for about 10% of the people who think they're interested in an inversion table. I do have a link to Amazon. It is an affiliate link. I'm just pray and hope that your back does benefit from it. Now, there's been people with amazing success with the inversion table. I'm not saying it never works. It just has to be the right person at the right time, the right size, the right weight, the right condition, and then they have a shot at getting better. Now, I never recommend you take medical advice from your neighbor down the street, because 9 times out of 10, they have something totally different than you do. And if they've gotten better from something, an inversion table as an illustration, because they had sciatica pain, that doesn't mean your sciatica pain is going to be the same cause. And that's why it's important to check with a chiropractor, a doctor, someone in the know, a professional that has seen all sorts of types of conditions. So, still thinking about the inversion table? Have I not talked you out of it yet? Well, in that case, let me show you how to safely use one. So we'll use this as a Teeter. Everyone's a little bit different, so make sure to read the directions. This one I like because it does have a safety strap underneath that you can see, so I won't go fully inverted upside down. Those that think that they want to work out or do sit-ups off the back of these, I just have to wonder, like, how much force do you need to get a strong abdomen and core? I can make your core as strong as you need it to be. Hopefully we're going to have an interview with a doctor in one of these other videos on how to really stabilize your core just using isometric exercise. just doing exercises on the floor. So I'll show you how to use this if you want to do it safely. What they say to do is to put your back against the board, put your feet on these little ankle clasps. These are very comfortable. I have to give Teeter credit, and that's why I chose to go with them. Like I said, they're like the Nike of inversion tables. The build quality is great on these. The instructions, very easy to build. You'll need it if you're having back pain and deciding to go with a Teeter. But I have no complaints on the quality of this. If you're going to spend money on it, this is probably the brand to go with. But you're going to pull a little lever here. But look what I have to do to pull the lever. What am I doing right now? Legs extended and bending over. I mean, that puts a ton of pressure on your back right there. Let's say you make it past that part. Because the biggest risk with these is not going upside down. It's what happens when you go right side up again. So the way you do this is if you just lay here and have it balanced correctly after reading the directions, then you should balance somewhere right in the middle here. And the way you're going to go upside down is slowly lift your hands above your head, okay? So as I move my hands up, you can see I just start to go down into an inverted position. I have, wow, that safety strap's not working too well. I must have set it wrong, which, oh my gosh. Okay, so you have your hands like this, a lot of blood into your head, so make sure you check with your doctor, make sure that's not an issue. But you can control the tippiness with your hands and how much traction you want to put on the spine. So right now I'm guarding so much with my body that my legs are actually tense and my feet are kind of, I don't know how to say it, like it's called dorsiflex. So my toes are pointing up because I'm guarding my back. So if I totally relax in here, then that's giving me the stretch that they say is going to change my life. Is my life changed? No. Is blood rushing to my head and it feels like it's going to explode? Yes. But they do say if you do this consistently after a while, then you'll have less issues with that pressure into your head. So to right myself, most people think they're stuck here. So they'll call 911, they'll call a family member. Most people will swing up quickly, which could be very painful. But really what you do is just move your arms down towards your thighs. You can even bend your legs a little bit to right yourself again. Before you totally right yourself again, stay in this position here just so your blood flow gets normal circulation and so you don't re-weight that disc or re-weight that facet joint the way you want to. It's going to trigger more nerves than you want it to. What I recommend if you do get an inversion table is get in this position and you can kind of just push out with your arms like this. But you know what else? You could do this in a lot of different positions just at your home using an exercise band, stuck in a door. There's a TRX you can push yourself up against. There's a total gym I'll show you how to in future videos. I mean, just re-weighting my spine like that, it hurts. And I don't have back pain. So I'm sorry if you've been looking forward to getting an inversion table and I was the one that talked you out of it, but I want you to be totally well. I want every day to just you working to live at your highest potential, you know, great wellness, feeling great, great experiences with other people. That's all I have today on the Teeter and an inversion table. I hope you buy one if you're one of the 10% of the people, but if you have a disc issue, I forbid you to buy an inversion table. We will talk to you next time. Thank you for watching. If you like this video, then please give it a thumbs up because it does help my channel. Subscribe to this channel if you like silly videos about wellness or want some fitness app instructions or recommendations or pain recommendations. Guys, my name is Dr. Eric Duncan. We will talk to you soon.